and welcome to Time with Lydia, the pharmacist. Our topic today is measles, and we are going to look at the risk factors, the symptoms of measles, and how to manage the symptoms. Measles mainly occurs in children, but adults can also develop the infection. There's an outbreak of measles in some parts of America and some parts of the UK. So it's important that we all equip ourselves with this knowledge so we know what to do when anyone close to us develops the infection. Measles is a viral infection. When someone with measles coughs, sneezes, or talks, droplets spray into the air, and when you breathe in these droplets, you can develop the infection. You can also get measles when you touch a surface that has these droplets and touch your mouth, your nose, or your eyes. Now, as I said earlier on, anyone can get measles, but you're more at risk if you haven't been vaccinated with the measles vaccine or you've had only one dose of the vaccine. Also, if you travel to places where measles regularly spreads or where there is an outbreak. Another group of people who are highly at risk of developing measles is students who live in dormitories or those who have a weakened immune system. Also, infants who are not old enough to get the vaccine are at a higher risk of getting the infection. Now, let's talk about the symptoms of measles. The first symptoms of measles include a cough, a high temperature, a blocked or runny nose, sneezing, red, sore, and watery eyes. Some people may also get small spots in their mouth, and these spots can last a few days. A few days after the cold-like symptoms, you will develop a measles rash. And this rash starts on the face, behind the ears, and then starts spreading on the rest of the body. These rashes are sometimes raised and they join together to form blotchy patches. One significant characteristic of measles rash is that they are not usually itchy. Measles usually start to get better in about a week. Let's move on now to how to treat measles. There is no antiviral treatment for measles, but there are some basic home remedies that you can carry out to help ease the symptoms and prevent the spread of the measles virus. So let's dive into that. The first one is to take enough rest. Rest is very important when you contract the measles infection because it helps speed up the healing. So as much as possible, take enough rest. Also, make sure you stay hydrated. Drink enough fluids, especially water, to avoid dehydration. You can also take painkillers like paracetamol or ibuprofen if you develop fever. If it is your child, you can give them some paracetamol or ibuprofen as well. But make sure that before you take any of these, you speak to your community pharmacist for advice. If you or your child's eyes are crusty as a result of the infection, you can soak cotton wool in warm water and use it to clean the eyes gently. Now, as I said earlier, the infection would go away in about a week. You are highly infectious when you first have the symptoms, usually 4 days before the rash appears and 4 days after you develop the rash. So when you or your child is diagnosed with measles, it's important that you keep your child away from nursery or school and you stay away from work if it is yourself for at least 4 days from when the rash appears. Also, try to avoid contact with babies and pregnant women as well as anyone with a weakened immune system. As much as possible, wash your hands regularly with soap and warm water. And if you don't have access to water, use a hand sanitizer regularly. When sneezing or coughing, make sure you cover your mouth or your nose with a tissue and dispose of it in the bin immediately. Make sure you don't share cutlery, cups, towels, and burdens. Now, our take home for today: getting the measles vaccine is very important for the prevention and the spread of measles, especially during an outbreak. The requirement is 2 doses of a vaccine known as the MMR, which is measles, mumps, and rubella. It provides a lifelong protection. So if you or your child have not been vaccinated, make contact with your healthcare provider so they can arrange for you to get the vaccine. I hope this video is beneficial. Please don't go without giving it a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of our educative content. Leave your comments and your questions in the comment section. Thank you once again for your time today, and I hope to see you soon in the next one. Bye for now.